Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Today we're announcing 2 new cases of COVID-19, one in the central zone and one in the northern zone. And both cases are connected to previously reported cases. And we now have 32 active cases in our province. Our vaccination program continues to roll out, and Dr. Strang will have more details on that for you. But I can tell you, as at the end of day yesterday, we've administered 7,600 doses of vaccine. 2,200 frontline healthcare workers have received their second dose, and frontline workers and long-term care residents at Northwood's Halifax campus have received their first shot. We are also running clinics in 2 of our other largest long-term care facilities in the province. All workers and residents should have their first shot by the end of next week. Next week will be an important week for our province. We'll be running clinics in 3 other long-term care homes, including 2 in Cape Breton. We will be starting a Truro clinic for frontline healthcare workers and are continuing to operate clinics in Halifax, Cape Breton, and the Valley. I know there's lots of concerns about how our vaccination program is rolling out. Dealing with this vaccine is not the same as dealing with the flu. Moderna supply is expected to arrive every 3 weeks. The Pfizer is expected to arrive weekly. That is, if there is no interruptions, we will continue to provide our vaccination program. It has to be in cold storage, and we need to move it across our province safely. We cannot waste a single dose of this vaccine, and we are continuing to give the first shot and hold back the second shot to guarantee people a full vaccination. We will continue to do this until we are guaranteed there will be no interruption in supply. And right now, we don't have that guarantee. Today, our numbers are as close to real time as possible, and going forward, we will report vaccinations completed twice weekly. I want to thank the volunteers who are transporting this vaccine, operating our clinics, and of course the nurses and doctors who are giving people that much wanted shot in the arm. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And as the Premier said, we have 2 new cases of COVID-19 to report today, one in northern zone, one in central zone, and both are close contacts of previously reported cases. So since October 1st, there have been 461 cases in total, and 429 are now considered resolved, leaving 32 active cases of COVID-19 across all 4 health zones in the province. And unfortunately, we still have no one in hospital. As the Premier mentioned, as of today, we are officially 2 weeks out from New Year's, and our epidemiology is looking good, but we cannot celebrate yet. COVID is still here. It is all around us, so we must continue with our slow and cautious approach. In terms of testing updates, mandatory testing for rotational workers who work outside of Nova Scotia, Prince Edward Island, and Newfoundland and Labrador starts today. They must get tested twice, once on their first or second day in the province, and again on day 6, 7, or 8. They must complete their full 14 days of modified self-isolation, which means that they can be out and about with their people who are in the same household, but they can't have close interactions with other people in the community. They can't go into stores. They can drop their kids off at the rink, but they can't go into the rink themselves. Things like that. And that modified self-isolation must be maintained even if they have a negative test result. And that's simply because, as I explained the other day, that a negative test result is not a definitive proof that somebody is not infectious. It's a good indication that they're negative at the time, and the risk of them becoming positive in the next few days is less, but it's not a guarantee. So testing the rotational workers is an important step in detecting infection as early as possible, and detecting the infection before the other people who were in there, who they're allowed to be isolating with, we know about any infection before those individuals in the household can themselves become infectious to others when they're out and about in the community. Moving on to university students, to date we have seen slightly over 3,500 post-secondary students arrive from New Brunswick or other parts of the country for the winter term, and we expect to see a few more in the coming week. They have been quarantining as required for 14 days upon arrival, and we're asking them to be tested halfway through that quarantine period. We know that over half of them who have been tested, and amongst of all those that we've seen 9 positive cases, and all of those cases were doing what they're supposed to do. They came, they self-isolated, and because they were self-isolating, doing their quarantine, they hadn't had exposure or exposed anybody else while they were infectious. So the program is working, I'm very pleased. By all reports, whether it's talking to local public health as they're following up the positive cases, talking to student groups, talking to universities, the students are very much taking seriously this need for quarantining as the primary step to keep themselves and everybody else safe as they come back to start the winter term. So I want to thank all the students for their hard work, thank the universities for the support they're giving, and the communities in which the universities are situated for all the support they're giving to those students. It continues to make a significant difference, our ability to bring students in from other parts of the country and even internationally, but doing that in a safe manner and allowing them to get an education here in Nova Scotia. And if there are students who are quarantining and you haven't had a test yet, and if you come here more recently, it's important that you do go halfway through your quarantine and get that testing done. We'll also be, as we get to the end of the 14 days, we are going to then bring up our pop-up testing capacities into the university communities as a way to further have access to testing as we move out of that quarantine period. People may have heard there's an ongoing cluster of COVID cases in the Truro area, and in public health, we are encouraging anyone living in that area who wants to be tested or thinks they might have been exposed. There have been a number of community exposure notices in that area go online and book a test. There is a primary assessment center in the Truro area. We're also the public health mobile unit is in Truro today, was there yesterday, and is going to be there next week as well to increase capacity for testing in that community. So I want to remind all Nova Scotians that we have both our symptomatic and asymptomatic testing streams available at the primary assessment centers, and those are throughout the province. There's very good access regardless of where you live to get to a primary assessment centers. So if you feel unwell in any way, please do the online self-screening and get direction on testing. And even if you don't have any symptoms and you think you want to get tested, we would encourage you to do that. And this is most important for people who have a lot of interaction with other individuals, whether it's because of their work or because of their social activity. And we're also continuing with our pop-up sites around the province. And as I said earlier this week, those are because of the rapid tests that we're using at the pop-up sites are only licensed for people 16 years of age or older. You have to be that age to go to one of the pop-up sites. For folks who are looking to where they can get a test, that all the information around the locations for the pop-up sites, the dates that they'll be there, are on the Nova Scotia Health Authority website. So if you're looking to take advantage of the pop-up sites, going on the website will let you know when there's going to be one that works for you. So I want to talk a little bit more about the vaccine rollout, building on what the Premier said. First and foremost, I want to thank everyone who's working to support the vaccine rollout. I've said it before, and I'll say it again. This is the biggest and most complex, not just vaccine program, but I would argue the most complex healthcare initiative that we have rolled out in this province. And there are hundreds of people across the healthcare system working very long hours to make this happen. There are people behind the scenes doing all the planning. I do want to give thanks for our colleagues in the Canadian Armed Forces who are the term they use are embedded with our healthcare planning staff, but the support that we're getting from the Canadian Armed Forces is invaluable. So I want to thank them for that. We also have in the health authority, we have clinic staff, public health staff, occupational health staff who are on the front lines administering the vaccine, along with staff in long-term care facilities. As I said, people are working long hours. There was a team of volunteer doctors led by Dr. Shelley McNeil yesterday who worked very long day yesterday at the Northwood Halifax campus, simply to make sure that the staff immunization could be finished and that all the designated caregivers could be immunized. And they did that on a volunteer basis. So thank you to those physicians who did that. It's testament to, yet again, I've seen throughout this, and the Premier's seen that when we need to get things done, Nova Scotians will come together and get it done. So thank you. We know that healthcare workers in Cape Breton and the Annapolis Valley started to receive the vaccine this week. The first vaccines in Northern Zone for healthcare workers will start when we open a clinic at Colchester East Hants Health Centre in Truro. We have 3 long-term care facilities who are immunizing this week, Northwood, Halifax, and Bedford campuses, as well as Shannock's, Parkstone Enhanced Care, and Ocean View. Next week, Shannock's Harbourstone Enhanced Care and Northside Community Guest Home, who are the 2 of the largest long-term care facilities in Cape Breton, will start immunizing staff, residents, and designated caregivers as well. We have a cold storage site that is set up in Yarmouth, and 3 more are being established in Antigonish, Bridgewater, and Amherst. These are in the implementation phase, and all of these 4 will be 4 more additional sites that will be able to start receiving and administering vaccine early in February. So up to date, I know lots of people look at the numbers of our vaccine and have questions. So up to date, we've received, or up till yesterday, we received slightly over 13,000 doses of vaccine. All of that has either gone into people's arms, mostly for a first dose, some for a second dose, or the rest has been held back and it's scheduled to go into somebody's arm for a second dose. So all of that initial 13,000 doses of vaccine has been used in a timely manner or has a schedule to be used. Yesterday, we got another 10,000 doses of vaccine. Because of the fragility of this vaccine and the temperature requirements, it has to be broken. The packages have to be opened. The vaccine has to be repackaged under strict requirements, and then it has to be shipped out to our multiple locations across the province. And that 10,000 doses of vaccine will start to go into people's arms on Monday and will be used by the end of the week. So our goal is to make sure that we have a constant and steady supply of vaccine going to clinics. We don't want to have a surplus of vaccine in the province, but also we have to be we're cognizant that we have to make sure people have access across the province. So we have to make sure we ship vaccine in an equitable basis to multiple locations. If we send too much vaccine to one site, we run the risk of wastage. If we don't have enough vaccine, then means that the clinic has to be shut down, and we have immunizers who aren't able to do the work that we're asking them to do. So it's an ongoing balancing act to ensure that what we receive goes out to clinics in a timely way and is used. But it takes can take a bit of time to get it shipped, and then it takes. It's several days to perhaps use that allotment of vaccine that is available. So I want to end up by talking a little bit about some concerning things that have come my way in the last couple of days. So it's been recently brought to my attention that in a few of our ongoing investigations by public health, there are some individuals who have been very deliberately not following the public health regulations, and they have not been truthful and honest about their movements and people they have been in contact with. And this lack of information has delayed investigations and is leaving more time for the virus to spread in communities. I have to say I'm very disappointed by this news. By not following public health orders or disclosing contacts, these individuals are putting other people's lives unnecessarily at risk. Most of Canada is in the middle of an intense second wave and is dealing with substantive health impacts that require heavier restrictions than we have here in Nova Scotia. We also know how quickly, however, that the virus could spread if we just look to our neighboring province in New Brunswick. So following public health restrictions, and if public health contacts you, giving them accurate, full information is critically important to minimize the chance for any community spread. So I would ask any Nova Scotians who think that public health measures don't apply to them to think again and to stop and think about the rest of the province, the rest of Nova Scotians, and the sacrifices that so many of us have made. And I'd ask those individuals to say you need to do better. It's the only way we can keep our province safe is by having all of us taking COVID seriously. So I'd like to end up by saying I have a couple of things that every time we've asked a lot of Nova Scotians, we're 10, 11 months into this, and I know people are tired, but I'm going to ask a couple of things of you today. You need to ask you to continue to follow all the necessary precautions around COVID to keep yourself, your family, your community safe. Continue to wash your hands, maintaining physical distance, wearing your mask where it's required. If you're feeling unwell, stay home. Keeping your social activities small and controlled with a consistent group of no more than 10. And if you really are concerned about, as I talked about testing, asymptomatic testing is accessible for anybody. We have come a long way, but we are not out of the woods yet. I can't stress that enough, that we are in a very precarious situation. We are one of the safest places, certainly in the country, if not globally, but we can only stay here if we continue to stay committed. So, and I also want to, so some people are hearing a lot of, people are saying, I can't do this, I can't do that. I would ask people to refocus their thinking and think about what you can do, that we still have the ability to get outside and explore our beautiful province. You have the ability to go to a local gym or a local sport and recreation facility. People can be involved in sports for practices or arts and theater for rehearsals. People can go out to restaurants, and you can get together with small groups with your friends or family. There are many parts of the country that aren't even able to do these things. And even though it may be frustrating and people have had to make a lot of sacrifices personally and financially, I would ask that you step back and really focus on how fortunate of a position we really are in here in Nova Scotia. And that is simply because people are remaining committed to doing what we need to do. But my ask is that we have to commit for a while longer to do that. And my last suggestion to you, or plea to you almost, is that we need to consider how we support local businesses, many of whom are struggling as we deal with this pandemic. Online shopping may be convenient, but also our local businesses need our help. So if at all you have a local option, please consider shopping locally. So I hope you have a great weekend, that you remain safe, and please know just how much others appreciate each and every time you individually rise to the challenge of dealing with COVID. This is how we will get through this, by doing it together, by caring for each other, by building up our communities and using our common sense. Premier.
Thank you, Dr. Strang. And I just want to add my voice to his comments that if you've been contacted by public health, we require you to be honest. We're not judging you. We won't be judging you. We're trying to track this virus. So many Nova Scotians have sacrificed so much over the last number of months. Let's not falter now. And Dr. Strang and his team of public health have been doing a tremendous job, and the only thing they care about is the virus. So please be forthright and honest with them when they ask you questions. And just before I open it up to take questions, I want to give a shout out again to Richard and Deborah, who are here and continuing to inform and making sure that all Nova Scotians are being informed. So thank you both for helping us get our message out.
Thank you, Premier. We will take one question and one follow-up in the amount of time that we have allotted for today. First question will go to the Chronicle Herald's Nabal Snan.
Good afternoon. I wanted to ask Dr. Strang about the testing that we were going to do for Ontario. Are we still doing that, and how has that been going?
So I'll be honest, I haven't checked on that for a while. The last I heard was we'd had the arrangement all in place for Ontario, but we'd actually never received any specimens from Ontario to test.
Go ahead with your follow-up, Nabal.
Mm-hmm. Thank you. I also wanted to ask you to shed some light on something that I've come across. So we've heard time and time again that face shields don't replace masks, but there are people that are going to establishments and demanding services when they're wearing a face shield, saying that they can't wear a mask due to a health condition. So can you shed some light on that, please?
So there's two issues in there. So we have made masks mandatory in indoor public places, but we have had an allowance. There are some people, the numbers aren't large, there are some people who have legitimate medical reasons where they can't wear a face mask. And we need to accommodate those. Some are health conditions, some are other people with certain intellectual or other disabilities. We need to make sure that those people aren't discriminated against. But the obligation is for all the rest of us Nova Scotians is to not make up a reason why you can't wear a mask. It's only the people who have a legitimate medical reason. But wearing a face shield actually doesn't replace a mask. It doesn't actually give anywhere near the protection. A mask over your nose and mouth, and I have to emphasize, I still see too many people not covering their nose. A mask prevents, if you're infected, greatly decreases the amount of virus that gets out of your nose and mouth and decreases the chance to infect others. A face mask does not do that. You're breathing or coughing, sneezing, the virus gets out and around the face mask. So face masks actually protect the eyes of the wearer. They don't do this do anywhere near the same function of wearing a face mask. So, people can wear them, but I would ask people to not feel that they're providing the same level of safety for the people around them by choosing not to wear a mask and putting on a face shield. Unless you have a legitimate reason to not wear a mask, put on a mask.
Next question will go to Alicia Draus with Global.
Hi, thank you. Can you talk a little bit about what we know about how vaccines will be distributed once all the healthcare workers and long-term care workers and residents receive their vaccines? What's kind of the next step, and when are we expecting that to happen?
So that we're looking at, we expect to get much greater supplies of vaccine in April, maybe even in May. We're just hearing today that Pfizer has announced globally that they're going to have to decrease production of shipment of their vaccine globally for a short period of time. So we still have challenges with being assured of the vaccine that that are scheduled to get that we're actually going to get. But we anticipate getting much larger amounts of vaccine as we get into, as I said, around the spring. Once we do that, we'll shift from our model, which is right now based on immunizing very select groups of people, whether it's in hospitals or long-term care facilities, to a community-based model, where our main priority of who gets immunized first is going to be based on age, because age is the single biggest risk factor for getting severe disease. And we're right now working of what type of different models would work for a community. It's not just one type, but it could be working with a pharmacy, working with bringing a range of vaccine providers together in a community clinic using a community space. So as I said before, part of what we're doing in the first phase is trying out these different models and seeing which ones work most effectively. And then when we get more vaccine, which, as we expect in the spring, being able to then immunize large amounts of people in a very rapid manner. But it's not till spring. I really want Nova Scotians need to understand. Right now, we're getting very limited supplies of vaccine. 140,000 doses is what we're scheduled to get in the first 90 days of this year. That's only 75,000 people. It'll be springtime, late April, May, before we get much more robust supply where we can start doing much larger numbers of people.
Go ahead with your follow-up, Alicia.
Thanks. I'm just looking for an update on the discussion with the QMJHL. Under the current COVID circumstances and with travel restrictions in the Maritimes right now, Do you guys see it possible for hockey to resume anytime soon as initially planned?
So I had a conversation, my colleagues and sport colleagues in Community Cultures and Heritage with me. I had a conversation with people, Quebec Major Junior League earlier this week. We made it clear what the requirements are in Nova Scotia. We made it clear to them that while we support hockey, recognize the importance of hockey, that protecting the safety of Nova Scotians will always come first. So they're going to go back and think, and they have some work to do because they have to deal with 3 maritime provinces, and we're expecting to have more conversations with them. But again, I recognize the importance of hockey, but protecting the health and safety of Nova Scotians will always come first.
Next question will go to Heidi with CTV.
Hello. This may be a bit of a repetition, and I apologize, but I had recalled that earlier this year it had been said that seniors over 80 and seniors over 75 would be part of phase 1. So I just want to clear that up for seniors out there who may be wondering when they can get the vaccine, when that would be. Would that be in the spring then that you're talking about, or would that be sooner than that? The last talk was that it would be sometime in January.
Yeah, we're hopeful to be able to, not January, but maybe February or March, is pilot a couple of clinics, one in Halifax, one in Truro we're talking about, to bring people, whether it's 80, 85 in those. But, and that's a small way. Those are only 2 locations. And part of that is, as I said earlier, we're piloting a number of different types of clinics and how those may work. So some of that will happen in a modest way in phase 1. But overall, what I want all Nova Scotians to hear is that for by and large, it'll be the phase 2 getting into the spring before we have large numbers of people that we can actually vaccinate.
Go ahead with your follow-up, Heidi.
And how concerned are you about Pfizer cutting back deliveries when it comes to our supply?
So we don't know yet there's a call going on my team is on at 1 o'clock to understand more what this means in terms of exact numbers of supply for Canada and then for Nova Scotia. But we have a process in place. We've already talked about it this morning, that we've got a very solid processes in place that we can ramp up or ramp down depending on if there's variations in vaccine supply. So if we get a little bit less vaccine in the next few weeks, we can adjust our clinics and to accommodate that. On the flip side, if we get all of a sudden a large increase in vaccine, we have processes now where we can very quickly ramp up our program as well and use that vaccine in a timely manner.
Next question will go to Elizabeth Chu with CBC.
Hello, Dr. Strang and Premier, you've both talked about how there have been some people who have not been truthful about who they've been in contact with. And I'm wondering, first of all, if you can talk about how that has complicated contact tracing. And on top of appealing to people to do the right thing, is there anything else that can be done to encourage people to be truthful?
So what it does is, because if people aren't disclosing everybody they've been in contact with, it means that we can't take steps to identify them, have as close contacts, get them tested. And we've had a couple of cases where somebody has shown up as a case, and then when public health goes to investigate that case, then all of a sudden we link it back to a previous case that actually, if we've been given the full information in the first case, that second individual would actually have been under isolation as a close contact. But because they weren't, they've been out exposing people. So it increases the risk of exposure. We work with individuals and with families, and the circumstances that they're at. But also we are very clear that if we have enough evidence that we can use, if people have been not following public health regulations, that they have the ability to work with local police around fines. If people are not being truthful, they can actually be charged under the Health Protection Act as well. And so in all of these circumstances, we know that we have legal tools that we can bring to bear if it's appropriate and necessary.
I think it's important for Nova Scotians just to recognize we're not here to judge you. We're really here, the information you provide to public health is between you and public health. It just allows public health to reach out with the potential contact. This is really about the health and safety of Nova Scotians and slowing down the virus. We're not looking at any way to judge your movement or decisions that you have made. Our number one goal and only goal is to capture and wrap our arms around this virus as quickly as we can so it doesn't spread within the community. It really is about the health and safety of Nova Scotians. And I just want to say to Nova Scotians, we've come so far. The private conversations you have with public health will be private between you and public health. Please tell them everything, all the contacts that you have. We'll protect your information at the same time we protect the health of Nova Scotians.
Go ahead with your follow-up, Elizabeth.
Thank you. A couple of weeks ago, you talked about the logistical challenge of setting up rapid testing at the airport. It is being done at other airports. Given that that's how the virus is getting into the province, is testing at the airport something that you're revisiting?
So there certainly are a group of folks looking at testing at the airport, and we'll get engaged in that conversation. We're waiting to get a more robust proposal from them to see, to assess that proposal. People need to understand that testing is not a golden solution. It doesn't solve everything. It has its own limitations, but it also has a role that it can play. So we'll continue to look at testing, at what role testing at the airport could play, along with all of the rest of our testing strategy.
And you're seeing testing happening at airports where international travel is allowed in our country, Toronto, Montreal, Calgary, and Vancouver. But we will continue to work with our own airport, and I just want to give them a shout out. This has been challenging for them and the airlines who have been really probably had the biggest hit of anybody in the last 10 months in terms of their overall business. But we're going to do whatever we can to help protect the safety of Nova Scotians.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. For Dr. Strang, I'm wondering if the province has yet engaged with pharmacists regarding vaccination clinics for the spring rollout, and if so, at what stage are these discussions?
So we've had a number of conversations with the Pharmacy Association of Nova Scotia, just like we've had conversations with Doctors Nova Scotia. Those are ongoing discussions. We've laid out for them as recently as yesterday or the last couple of days what it would take in terms of to run a clinic and what would be the requirements. So we'll continue to look to see how they are able to be involved in as we start to do the detailed planning for community clinics in the spring.
Go ahead with your follow-up, Lindsay.
Thank you. I'm hearing from people in the 80 and older age category of 75 and older who are wondering about how they'll actually be notified when it's their time to be vaccinated. How will you go about contacting and bringing in these people for vaccinations when it's their time?
So we're working on a process for individual notification. It hasn't been finalized. One of the things we're looking at, could we use the information that we have, people who have their MSI card, and then we can contact people individually. We understand that just putting an advertisement out in social media or the paper is not going to be sufficient. So we're certainly looking at ways that individual Nova Scotians will get direct information when they become eligible for COVID vaccine.
Next question will go to Mike Tutton with the Canadian Press.
Good afternoon, Premier and Dr. Strang. The East Coast Prison Justice Society, which is a prisoners' advocacy group, says conditions at the Burnside jail are increasingly inhumane due to almost constant lockdowns, lack of fresh air amidst the COVID pandemic. And they also say the numbers in custody are back up to pre-pandemic levels. So for Premier, will the province resume or increase efforts to reduce the prisoner population during COVID?
Well, as you know, and I think your question alludes to, at the very beginning of the pandemic, there were a number of steps taken, especially those that have been remanded or to reduce the number of people who were serving their obligation to the province, serving it in prison, or doing part of that in the community. I don't know if those restrictions have been lifted. Mike, I can check back with the minister about that.
Go ahead with your follow-up, Mike.
And I guess this for Premier and Dr. Strang is, And I'm hearing you quite clearly on the order of the rollout, but when will vaccinations be provided to the prison population, given the conditions being described by the advocacy groups? And should a higher priority be considered?
So we know as along with our general, as we get into general immunization with our community clinics, we've also identified vulnerable communities and populations and in two main areas. We have communities that have, because of long-standing socioeconomic and other challenges, have in general a much higher risk from COVID, and we're working with both our African, Nova Scotian, and our First Nations communities around those. We also know that there are settings, whether it's in homeless shelters, correctional facilities, that there are people are both higher risk in higher rates of poor health, but also higher risk of an outbreak if COVID gets introduced. So part of our planning is actively looking at how do we make sure that those vulnerable populations and settings get included in a timely manner as we were able to once we get much greater vaccine supply.
Next question will go to Paul Legier with Radio Canada.
Yes, hi. We're looking here at what's happening in Quebec in so much as holding back the second dose past as far as 90 days. We're working on a story to see what the situation is in the Atlantic provinces on possibly holding back longer than the 21 days that Pfizer recommends, or the National Advisory Committee on Immunization says go as high as 42 days. Would it, for Nova Scotia, what is the situation? Would it be a possibility to hold back on the second dose past 21 days or past 42 days, depending on circumstances?
So if you look at the language in the National Advisory Committee on Immunization, and I was part of the Council of Chief Medical Officers of Health, we released a statement on this in the last 48 hours. Both of those languages is that where possible, jurisdictions should stick with the schedule of the vaccine that it has been licensed under. That's the approval given. But if there are, whether logistic or epidemiologic circumstances that provinces could consider extending the interval between the first and second dose up to 42 days. We are not in either. We don't have logistical challenges, nor does our epidemiology justify moving off the approved schedule. We've had a conversation earlier this week with our provincial vaccine expert group. We're very fortunate to have a number of international and national vaccine experts right here in Halifax, and they were unanimous in their advice to the provinces that we stick with our 21 to 28 day schedule.
Go ahead with your follow-up, Paul.
Yes, I was just wondering, when speaking to your counterparts in Prince Edward Island and Newfoundland and Labrador, has the question ever been raised of the possibility of dropping the self-isolation requirements for Nova Scotians traveling to PEI and Newfoundland and Labrador?
So I'm in weekly discussions with my Atlantic Chief MOH colleagues. I know the Atlantic premiers talk. When and how we might reconstitute the Atlantic bubble is certainly an issue that's out there. We're not in any a situation yet in any of our provinces, but ultimately the decision about dropping the quarantine for Nova Scotians is not our decision. It's a decision for one or more of the other three Atlantic provinces.
And I'll just add to that. Islanders and Newfoundland and Labradorians are able to come to Nova Scotia now without self-isolating. Right now, there's a restriction on those in New Brunswick for 2 weeks. Obviously, we're very mindful and conscious of what's happening in our sister province next door, and obviously sending our best wishes to them as they continue to deal with the issue of the outbreak. And our goal will be, as soon as public health gives us the go-ahead, that New Brunswickers will be able to come without having to self-isolate here. But that'll be some time out, and we'll continue to work with our sister provinces about the mobility of our own citizens in and out of their provinces.
Next question will go to Zane Woodford with the Halifax Examiner.
Hi there. As you mentioned, sort of off the top, people are really interested in those vaccine numbers. So why are we reporting them weekly rather than daily?
So, as the Premier said, we're going to be shifting to at least twice weekly, if not more frequently, starting next week. We're looking at just how we do that, and it's recognize the importance of having as up-to-date numbers as possible. We started reporting weekly simply because we were reporting our initial numbers, once a week up to the national level as well. But clearly, we need to do that more frequently, and we're working in that process. More to come on that next week.
Go ahead with your follow-up, Zane.
Is there a plan for immunizing people who are under the age of 75 but are at higher risk for COVID due to underlying conditions?
So as I said, that's part of our main focus when we get to community clinics is going to be based on age. We know that age, when you talk to the clinical experts, age is by far the single biggest predictor of risk for severe outcomes from COVID. So if we take a focus that's based on age, we will start to then also incorporate people within those age category with underlying health conditions as well.
Next question will go to Victoria Walton with the Coast.
Thanks. So I'm wondering about our vaccination numbers just in terms of daily doses that are being given out. I know we are reporting now twice a week, but I know when we first started those first trials at Dow, it was kind of around the 300 to 400 a day, and eventually we are hoping to get up to 10,000 people vaccinated a day. I'm kind of wondering what we're at this point.
So I don't have a daily number in front of me. The more clinics we add, as we're adding them all the time, clearly the higher our daily dosage goes. You'll see more information, and as I said, we're going to increase certainly the frequency of our reporting of our immunization numbers, which will get you closer towards that daily amount, and that's starting next week.
Go ahead with your follow-up, Victoria.
Thanks. This question is about a particular restaurant in Lower Sackville that I'm sure public health is aware of. They're hosting some sort of peaceful assembly this afternoon, and I'm just wondering whether public health is aware of that happening and whether they'll be attending or supervising or anything like that. And also at what point, public health can shut a restaurant down for repeatedly violating regulations.
So I wasn't aware of that. People have the right to get together as long as they're following the public health regulations. I'm sure that local law enforcement will be are aware of this and will be taking appropriate steps to monitor. We're certainly aware of this restaurant, and they've already been fined. And I know my colleague, compliance from also the food safety inspectors who are part of this have been involved in that investigation and response by local police. It's local police, not public health, that actually we turn to when there's a clear violation of the public health regulations. And we're in ongoing discussion at my level with chiefs of police around their important role in ensuring there's compliance around this specific circumstance. We would leave that to local police to monitor and take the appropriate action.
Not speaking to that particular event, but I'm sure all of you remember we changed the public health order that not only those that are hosting and holding the event the potential of being charged, but those who attend and ignore the public health rules and orders also potentially run the risk of being fined $1,000.
Next question will go to Jean Laroche with CBC. Jean, are you there?
Sorry, I was on mute. Story of my life. Dr. Strang, you mentioned people not following the rules, lying or not being as forthright to contract tracers. I'm just trying to get a sense. Are we talking one or two people? Are we talking dozens of people? And you also mentioned that they weren't following the rules, and I'm curious to know what exactly they're not doing that they should be doing beyond the not fully disclosing what they've been up to.
So we have a few cases. I don't want to give the impression that this is widespread, but I think it's important that Nova Scotians understand that, and it was an opportunity to deliver a message about the importance for everybody to follow the rules and to be truthful. We've got issues around people who are meant to be quarantining or under modified quarantine and not following that. People getting together outside of the restrictions that are for social gatherings, and that's clearly created issues of transmission of the virus. And the lack of information has put us in a position where we weren't able to respond, and there's been further transmission of the virus, which is unfortunate.
Go ahead with your follow-up, Sean.
We know that everyone is focused and excited about the vaccine, but in realistic terms, Dr. Strang, when do you see things like the emergency measures being gone, mask wearing being gone, restrictions gone, and life back to what looks like and feels like normal?
So that's $1 million question, but I think if public health people like myself, experts on the virus, I think we're all pretty on the same page that most of 2021 we need to continue to be following COVID restrictions and COVID protocols for two reasons, or a few reasons. First of all, it will take time to get enough vaccine and to get it out and distribute it in people's arms to get a necessary level of herd immunity that adds that extra level of protection into the community. I think it's important that people understand that vaccines themselves are not a 100% solution. Vaccines are just another part of our COVID response, certainly in the short to medium term. We also know that there's still not data that would say that we could say that if you're immunized, that you do not have a risk of being asymptomatically infected and then passing the virus along to somebody else, even if you yourself are not sick. So certainly we expect more answers on that in the months ahead. But until we get clarity of that point, we still have to assume that even though somebody's been vaccinated, that they may be able to transmit the virus to somebody else. And so even people who are vaccinated are going to have to continue to follow all the COVID protocols. So it's a number of months at least until we I would say roughly 6 to 9 months at least before we can be in a position where we could really confidently be able to think about what a post-COVID world might look like.
That's all the time that we have for questions today.
Thank you, Chrissy. It's been 14 days since the holiday season, and so far it seems like we've come through it okay. We put a lot of restrictions in place, asked you to reduce the number of special dinners, didn't let you gather or outdoor celebrations, and needed you to have a quiet Christmas. From the looks of things so far, you've made every sacrifice. I know it hasn't been easy, but you did what you needed to do. And we are starting off the new year with low numbers and a renewed understanding that following the protocols, even while the vaccine is rolling out, remains our top priority as a province. I am so proud of you and this province for helping to slow the spread and keep everyone safe. We still have a number of restrictions in front of you. Dr. Strang and I will take a look at those in the next few days. But we do know that our restaurants and businesses are opened now, and that is a good thing. So I ask all of you to support local. But don't forget, when you go out to support local, take your mask. Have a great weekend.